In 2007, Khalil Ahmed Hijrت left his war-torn motherland of Afghanistan and began his undergraduate and postgraduate studies at China's Nanjing Medical University and Southeast University successively. Hijrت is now still a PhD student at Southeast University, though the epidemic postponed his study. Currently, he serves as the health director of the Afghan Red Crescent Society, the country's major charity.
The Health Directorate of Afghan Red Crescent Society has around 225 health facilities. We have 36 routine immunization teams who are working for the polio eradication. We have 65 emergency mobile health teams working in Afghanistan in case we have a disaster. So for the management of the disaster in the health field, we work there.
Once working as a resident doctor at the Zhongda Hospital of Southeast University, Hijrت highly commends the high-end technology and quality medical education in Chinese hospitals and medical schools. Currently, his department is responsible for 8 medical projects, the most important of which is saving children with congenital heart diseases.
Until now, we have registered around 26,000 patients, and around 13,000 patients has been operated inside and outside the country.
Hijrت said that he had yet to decide when to return to China to continue his study because he was working around the clock in Afghanistan, and crowds were waiting for assistance and aid from many willing to devote themselves to nation rebuilding like him. For decades, and especially since the pullout of the U.S. Army in August 2021, numerous batches of Afghan students traveled to neighboring China for higher education.